Hey everyone, it's Dr. Jess. Welcome and welcome back to my channel. Today's video is the second video on the Pharmacology of Cardiovascular Medication series. We're going to focus on angiotensin receptor blockers. Please don't forget to like the video, subscribe to the channel, and turn on your notification bell so you don't miss out on any new uploaded videos. Okay, let's get started. How do angiotensin receptor blockers work? Angiotensin receptor blockers block angiotensin 2, which is a vasoconstrictor, from binding to the AT1 receptor on vascular smooth muscle, therefore preventing vasoconstriction. Angiotensin receptor blockers are also known to slow the progression of kidney disease. How do you identify angiotensin receptor blockers by their generic name? So all angiotensin receptor blockers, their generic name would end in sartan. So for example, losartan, brand name is Cozar, valsartan, brand name is Diovan, irbesartan, Avapro, candesartan, Adacan, olmesartan, Benicar, and telmisartan, Mycardis. So all angiotensin receptor blockers, their generic name will end the same way, in sartan. Let's look at this practice question together. Which of the following drugs is an angiotensin receptor blocker? Determine its brand name. A. Metoprolol, B. Amlodipine, C. Losartan, D. Lisinopril. And the correct answer is C. Losartan. So we know all angiotensin receptor blockers, their generic names end in sartan. So which makes the correct answer C. Losartan, and the brand name is Cozar. Metoprolol is a beta blocker. Amlodipine is a calcium channel blocker, and lisinopril is an ACE inhibitor or angiotensin converting enzyme inhibitor. What are angiotensin receptor blockers used for? Some common conditions that angiotensin receptor blockers are used for include hypertension, heart failure, and chronic kidney disease. Some of the side effects to be aware of when it comes to angiotensin receptor blockers: hyperkalemia, hypotension, angioedema. And be aware that this is not a complete list. Monitoring parameters: monitor blood pressure, monitor potassium, and renal function. Let's look at this practice question together. Which of the following medications can cause hyperkalemia? A. Metoprolol, B. Hydrochlorothiazide, C. Enalapril, D. Losartan, E. C, and D. Please write your answer in the comments below. I'm going to give you 5 seconds to write your answer in the comments below. If you wrote E, C, and D, you are correct. So the answer is enalapril and losartan. So E, C, and D. Both ACE inhibitors and angiotensin receptor blockers can cause hyperkalemia. Contraindications to the use of angiotensin receptor blockers: if you have a history of angioedema, pregnancy, they are contraindicated in pregnancy, and also if you have renal artery stenosis. Let's look at this practice question together. How would you educate your patient about the use of valsartan? A. It is safe to use in pregnancy. B. It can cause cough. C. It can cause hyperkalemia. D. A and B. E, B, and C. Let me know what your answer is in the comments below. If you said C, it can cause hyperkalemia, you are correct. So A is wrong because valsartan is contraindicated in pregnancy. B, ACE inhibitors are the class of medications that are mostly associated with the dry cough. So that is more likely to happen with an ACE inhibitor like lisinopril. C, it can cause hyperkalemia. That is correct. Angiotensin receptor blockers can cause hyperkalemia. That is all I have for today. Please don't forget to like, subscribe on your way out. I'll see you in the next one. Bye.